It's only love and that is all. Why should I feel?
Wondering which toothpaste is the best? Watch this video for the answer to that question, my friends. For those of you who don't know me, my name is Priya Mistry, and I'm a general dentist with a practice in beautiful Vancouver, Washington. At my practice, we are dedicated to taking care of those with TMJ problems. I'm also creating videos on general dentistry, as I get a lot of questions about that as well. So let's get into it. Nowadays, there are so many choices of toothpastes out there. There's the mainstream ones we've all heard of, like Crest and Colgate. And there are the more obscure ones you find at health food stores. And there are ones for whitening or for sensitive teeth. So which is the best and why? Well, that all depends on your specific needs and wants. Let's start with the purpose of toothpaste, why we use it. I'll list off each reason as to why toothpaste is important and then explain each one individually. The four main purposes of toothpaste are to 1. Serve as an abrasive material, 2. Freshen your mouth, 3. Protect against cavities, and 4. Combat gum disease. Number 1, toothpaste serves as an abrasive material to remove dental plaque. According to the Oxford Dictionary, abrasive means a substance or material capable of polishing or cleaning a hard surface by rubbing or grinding. Dental plaque is a substance that sticks to teeth and contains food particles and sugars, destructive bacteria, and proteins, all of which are responsible for gum disease, dental decay or cavities, and bad breath. PU. Even the earliest known toothpaste, dating back to 5000 BC, contained abrasive materials, such as eggshells. Number 2, the next purpose of toothpaste is to freshen your mouth and improve bad breath. This can be done with some sort of herbal or minty flavoring, like mint oil. Number 3, the third purpose of toothpaste is to contain anti-cavity components. This is usually some type of fluoride or calcium phosphate or hydroxyapatite, a component of teeth. All of these ultimately strengthen the superficial layers of teeth, the layers that are exposed to all the bacteria, acids, and sugars in our mouths. Number 4, the final purpose of toothpaste is to decrease inflammation in the gums, thereby helping to prevent gum disease. The components in toothpaste that help with this are typically triclosan and stannous fluoride. Triclosan works by disrupting the bacterial cell membrane, and stannous fluoride will actually inhibit the growth of bacteria. Fun, huh? Now that we know a little bit about the purpose of toothpaste, let's talk a bit about how it all began. The history of toothpaste, if you will. The first record of toothpaste being used was around 5000 BC. The ancient Egyptians developed a mixture of hooves, eggshells, pumice, tree sap, and water. This was actually invented before the actual toothbrush. So the ancient Egyptians would use their fingers to rub their teeth with this special mixture. Interesting, huh? Ancient Greeks and Romans used something similar to the Egyptians, but added crushed bones and oyster shells. In ancient China, herbal mints were mixed with salt and ginseng to clean the teeth. Other materials that were used in toothpaste in ancient civilizations include fine sand, ground fish bones, salt, and charcoal. Let's now move on to more modern times. Modern toothpaste appeared around 1700. People used burnt bread, baking soda, charcoal, salts, and chalk. Lots of homemade toothpaste recipes were around for a while. For example, an 1860 book titled The Practical Housewife, you can probably imagine how much I love the title of that book, recommended a mixture of powdered orris root, powdered charcoal, powdered Peruvian bark, prepared chalk, and oil of bergamot or lavender. The idea of lavender in a toothpaste is not really appealing to me, but I guess some people may like it. Around 1870, Colgate developed the first toothpaste that was mass-produced. In 1956, Crest launched the first toothpaste to contain fluoride as a way to combat rampant dental decay due to poor dietary habits after the Industrial Revolution. As a side note, our diets have changed significantly since the Industrial Revolution. Processed foods, particularly sugar and refined wheat flour, lead to a dramatic increase in the rate of dental decay. This diet has also impacted the development of our faces overall, which can lead to TMJ problems. But that's for another video for another day. If you want more information now, check out the book, The Dental Diet by Dr. Stephen Lin. I've linked this below, and it's one of my favorite reads. It's just fascinating. Now let's talk about what makes the best toothpaste. A good toothpaste is slightly abrasive, but not too much, because that could damage teeth and gum tissue. It should be neutral or slightly alkaline, basic, rather than acidic, to help neutralize all the acidity in our mouths from food and the breakdown of sugar. The best toothpaste should also, obviously, be safe for us to use. There's a lot of interest lately in which toothpaste or consumer products in general have unsafe additives and preservatives that could potentially cause cancer or other health issues in the long term. Some of the most notable ingredients that have been studied and called into question include triclosan, propylene glycol, parabens, sodium lauryl sulfate, also called SLS, and diethanolamine, DEA. Studies have shown that these ingredients can disrupt hormonal function, cause allergies, cause nervous system defects, cause ulcers in the mouth, or affect the liver in a negative way. Many of these studies have not been globally accepted, but it's better to play it safe, in my humble opinion. Why are there always so many different types of toothpaste consistently coming out? Well, I think it's because consumers are always looking for the newest or the next best thing. But really, these newer toothpastes are very similar to their predecessors, but the packaging and the flavoring have been changed slightly. For example, next time you go to the grocery store, check out toothpaste brands and how much space a brand takes up on a shelf. The more space it takes up, the more noticeable it is. This is simple marketing. If you notice it more, the chances of you buying it are higher. So how should you decide on a toothpaste? I would say ignore the marketing tactics, study up, and look at the ingredients. What should you look for in a toothpaste? I'll list them off and go over each one individually. 1. Fluoride. 2. Hydroxyapatite. 3. Calcium phosphate. 4. Hydrated silica or sodium bicarbonate. 5. Essential oils, herbs, or flavoring. And 6. Potassium nitrate. Number 1. Fluoride. I know there are a lot of opinions on fluoride, but I've seen thousands of people's teeth, and those who grew up with fluoridated water simply have less cavities than those who did not have access to fluoridated water. I'm not here to argue about fluoride. The types of fluoride found in toothpaste include sodium fluoride, stannous fluoride, and sodium monofluorophosphate. I'm listing these off so that you know what to look for in ingredients when you go look for your best toothpaste. Number 2, hydroxyapatite. What the heck is that? Well, my friends, hydroxyapatite is a mineral that's actually found in natural tooth structure and in our bones. It provides structural strength to our teeth and to our bones. Number 3, calcium phosphate. This is similar to hydroxyapatite in that it provides structural strength to our teeth. Number 4, hydrated silica or sodium bicarbonate. These are basically the abrasive ingredients we talked about at the beginning of the video. These are important in a toothpaste because they provide mechanical removal of plaque and superficial staining. This might be helpful for those of you who drink a lot of coffee and or tea. Number 5, essential oils and herbs are important for breath freshening, and some of these oils and or herbs even have antimicrobial properties, which means they can help kill or stop the growth of bacteria. And lastly, number 6, potassium nitrate. This is used in Sensodyne and other toothpaste to help those with sensitive teeth. These work well, so if you have sensitive teeth, please check them out. Your teeth and their nerves will thank you. Let's move on to another question I get frequently. Can toothpaste actually whiten your teeth? Short answer is yes, but how well? Not very well. They can achieve some lightening of teeth where superficial staining is present. If you were to drink coffee out of a white coffee mug, leave the coffee in the mug for 2 days and then go to clean it. Just soap and a sponge may not clean off all the staining, and you may have to scrub it with an abrasive powder like Barkeeper's Friend to get all the staining out. If you were to have a coffee mug that had developed deep, penetrating stains over the course of 10 years, simply scrubbing the outside wouldn't work. This parallels the whitening of teeth or the staining of teeth, however you're looking at it. If the staining is deeper, then abrasives in toothpaste will not work. Some toothpastes now have hydrogen peroxide as a claimed whitening agent, but simply brushing wouldn't give it adequate time to penetrate into the teeth to whiten them on a deeper level. Hydrogen peroxide may work quickly to bleach or whiten hair, but it does not work quickly on teeth because hair and teeth are quite different in their composition. Are toothpaste different in other countries? The main difference is a variety of flavors and different philosophies on fluoride use. For example, Marvis, an Italian brand, has a toothpaste flavor called Italian Ginger Mint. Fun side note, Victoria Beckham was spotted with Marvis whitening toothpaste. And now, finally, what toothpaste do I recommend? My favorite toothpaste right now is Hello brand, which began as an independent company but was acquired by Colgate-Palmolive. It has a soft and smooth texture that is non-abrasive, has a delightful but mild fresh flavor, and includes fluoride. Hello is peroxide-free, dye-free, SLS-free, paraben-free, triclosan-free, preservative-free, and gluten-free. Another good mainstream toothpaste is Arm & Hammer baking soda toothpaste, which contains baking soda, sodium bicarbonate, which is supposed to help make your mouth less acidic and therefore less prone to cavities. If you have sensitive teeth, Elmex and Sensodyne are my favorite go-tos. I've linked all of these in the description box below. Let me know in the comments section what your favorite toothpaste is. I'd love to hear from you. Good luck and cheers to the health of your lovely teeth. I sincerely hope you found all the information in this video helpful. And now let's circle back around to my new segment, highlighting a TMJoiner. The comment I've chosen to highlight for this video is, what's the difference between an orthotic and a splint? I was recommended a surgical splint that gets adjusted monthly. So to answer this question, and first, thank you for this question, I never use the word splint because it can mean orthotic or it can mean night guard. A night guard simply protects the teeth. It does not treat the muscles and the joints that are contributing to the TMJ pain and dysfunction. A TMJ orthotic protects the teeth just like a night guard, and treats the dysfunctional muscles and joints. For more information, check out my video, Dental Night Guard versus TMJ Orthotic. So that's really it, my friends. Again, I'm Dr. Mistry, and I hope you found this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. For TMJ pain relief from the comfort of your own home, please download my free PDF guide called 3 Steps to TMJD Pain Relief. You'll find that on my office website, which is linked below. Go to the website, scroll all the way down on the home screen, and it's down there. Keep in mind that questions and comments are always welcome. And remember, my friends, you can never have TMI about TMJ. Thank you.
Very bright, just to make it up through. It's only light.